the first day of suturing, my surgeon said to me, the nail should be flat and tidy.
This video will demonstrate the surgeon's knot. And the surgeon's knot typically consists of 2 clockwise rotation followed by 1 counterclockwise rotation. We usually tend to put another clockwise rotation at the end of that to secure that knot fully. We're going to talk about the schematics first before going to the video. And if you notice in the schematics, once we have passed through both the buccal and the palatal or lingual tissue, the hand that usually has the needle in it will go 2 clockwise rotations around the needle holder, and that will allow us to put the first knot. Please have a look at figure D, which shows you where the position of the hand is first and where the position of the needle holder is, as that will switch when we do the counterclockwise rotation. This should allow us to place a flat knot, as the video will demonstrate for you. Once we've done that, we are going to do 1 counterclockwise rotation, and that also entails the hand holding the needle with the longer thread will go counterclockwise once, and as you notice in figure H, you will see that the position of the hand and the needle holder has switched to allow you to make sure that we have a flat knot across that side. This is usually when the surgeon's knot finishes, but we tend to add another 1 clockwise rotation in order to secure that knot fully. So in summary, we usually have 2 clockwise rotations, 1 counterclockwise rotation, and another clockwise rotation, making sure that the knot is flat across the surface. This video will demonstrate the surgeon's knot. And what you notice, once we have gone through both tissues, and it's always easier to go from the buccal towards the lingual or the palatal side, with the hand that is holding the longer thread and the needle, we do 2 clockwise rotations around the needle holder, grabbing the loose end, and then we throw that knot to give us the first flat knot. Please note the position of where the needle holder is towards the inside of the mouth and where my hand will be, which is towards the outside of the mouth. Once that is nicely secure and flat, we go 1 counterclockwise rotation around the needle holder, grabbing the loose end as well. Notice the difference now where my hand would have gone towards the inside and where the needle holder would have gone towards the outside to give me that flat knot. That usually tends to end the surgeon's knot, but as we mentioned, we add a 3rd clockwise rotation for security, and that's our 3rd one going through. And because it's a clockwise rotation, it resembles the position of the hands as we did in the first one, where the needle holder is going inside and the hand is towards the outside. Once that is done, we make sure that the knot is away from the cut end so it doesn't collect any plaque and debris directly into the site of the incision, and then we will cut that short 2 to 3 millimeters to make sure that it doesn't irritate the patient and it's aiming buccally.
On the first day of suturing, my surgeon said to